I'm Eirlys Thomas and I'm Deputy Head of Nursing for Children's Services at ABM Health Board.
I'm Carol Killa and the Head of Policy and Regulation for ABM Health Board.
And our work stream is about children's services, and we're looking at from 1 year age to 18. One of the biggest drivers for us is the lack of middle grade medical cover and the inability to cover the rotas across the M4 corridor within ABM Health Board.
So you're talking about a shortage of doctors?
Yes. So what we want is a safe, sustainable, high quality service for children and young people. And I think with the shortage of doctors, and we've got to really look at ways of addressing that, and about changing service provision to provide that high quality service. It's about having a service that is local for families, and having the right services in the right place at the right time for children, rather than just not within the hospital. It's looking at the wider perspective, it's looking at the primary care as well as the secondary care.
So Carol, what are the issues, what are the problems at the moment that not having enough doctors is causing?
Well, we just want to be sure that the service is safe, and there is a risk at the moment that we need to keep training doctors and bringing them through, and we are finding that recruitment isn't that easy in this area, so that is an issue for us. Currently we're providing a safe service, but we need to look at how we reconfigure services in the future. If we stop and think about it, most of the population of children are well and healthy. So what we really want is a service where somebody needs secondary care. They have very high quality secondary care. But what currently is happening, there's a grey area in the middle where children may need some interventions, they may need some investigations, even as something as simple as a blood test, and they have to go into a hospital setting to have that. If we could bring some of those services safely into a community-based setting, then what we'd find then is the doctors within the secondary care setting are freed up to deal with those ill children who need their help, and the families will get a safer service because they'll have facilities nearer to where they're based.
Are there any particular obstacles in your way at the moment?
The infrastructure isn't there at the moment. We need to look at our service, we need to modernise that service, to put those infrastructures in place. So that would be a challenge for us. And it's about doing things differently and changing people's ideas. That they've got to think very differently about the service. It's about modernising the service in line with other services that are being provided within England and Europe, really.
And it's reassuring families that it doesn't mean a reduction in their service. They will still be able to access paediatric services, and keeping families well informed.